Hello, everyone. Because of the increased stress levels, a lot of people are not having kids in a natural manner. And they are resorting to ART, assisted reproductive techniques, such as IVF, in vitro fertilization. And we all know that IVF success rate is very less in India and across the globe. And each cycle is not just expensive, it also causes a lot of mental stress on the couples. After the embryo is implanted, after a few months, or after a few weeks rather, the parents or the couple will understand whether they can have a baby or not. Until then, it causes a lot of additional stress. So to help reduce the stress, to help reduce the expenses of each and every cycle of IVF treatment, and to reduce the number of IVF cycles itself, we came up with a revolutionary AI solution in the form of Garba.ai. And let us give you a quick demonstration about our solution. While we share the screen, let me quickly tell you that when it comes to IVF, you take sperm from male, oocyte from female, fertilize outside to form embryo. This embryo, embryologists would understand the quality of that by observing it under the microscope. And there's a lot of subjective decision which goes into determining whether embryo is of good quality or not. However, if we can build an AI solution, you just upload day 3, day 4, day 5 embryo images, and AI solution can, with higher confidence, tell you whether the embryo is of good quality or not. So let's look at our secured access portal. We have doctor, embryologist, IVF specialist. We have logins for all. Once you provide your username and password, you log into our secured access portal. This is already deployed on our cloud, which is Amazon Web Services. You'll have a task calendar to schedule your tasks. You can go to patients and you can add the patient details. You can view embryo details of the patient, view the patient details, and new patient details sites. We have given an option for embryologists to just manually assess the quality of embryos. Let's give a patient ID. And then once we provide the patient ID details, you have to browse day 3, 4, and 5 images. Day 3 is called as 8 cells. Day 4 is called as morula. And day 5 is called as blastocyst. Once you upload the images, the microscopic images will show up here. And embryologists will have a marker to highlight that portion, which is forcing them to believe whether the quality is grade A, B, or C. Yeah. Can we quickly select the grades? It's just for demonstration purpose, so we are selecting some grades. And then you'll have an option to save by clicking on the save icon. And this is going to be saved in the backend database. And then you also have an option to add another patient details, and you can assess multiple patients' embryo at one go. If we scroll up, you'll have an option to choose AI assistant also, which will not be a replacement for IVF specialist or embryologist or doctor, but it will be an assistant. It will increase the confidence level and chances of successful IVF treatment. So here, our solution will also provide explainability AI, XAI, which will tell you what portion of the embryo is getting highlighted before calling out whether that embryo is of good quality or not, whether it is grade A, B, or C. And from day 5, which is blastocyst image, you will be able to get the expansion score, ICM score, and TE score. Combination of those 3 will give you a morphological score. And if we scroll down, you will have, as a doctor or embryologist or IVF specialist, an option to either agree with the AI solution or disagree with the AI solution, or freeze the egg for a later purpose, or you can also set a reminder for delayed decision making. Because After this is done, we also need to look at ERA, endometrial receptivity analysis. Using ultrasound images, we will figure out whether this embryo is pre-receptive or receptive or post-receptive. In the sense, is the woman ready for implantation or not? And also our solution has post-embryo phase, which is called as PGX, pharmacogenomic testing. And all these three components put together make a revolutionary AI solution in the space of embryo grading. Thank you so much. And please subscribe and get a quick demonstration about our product. We are already opening this for validation purpose. I'm sure you all can use it and you all can bring in more happiness into the lives of your patients. Thank you.